video is going to be how to do fluidotherapy with a client. This is a fluidotherapy unit, and it is actually a dry heat therapy, which you can heat to a higher temperature than liquid, and a person can tolerate it. It's in a tank with ground up corn husks. It also has a blower and a heater. If you look on this end, it has settings for treatment time, temperature, airspeed, pulse time. You can also preheat it and a clock. So what you want to do is find out if there are any contraindications or precautions before you use it with a client. You generally, the thing that you use fluidotherapy with the most probably is for desensitization of people who are hypersensitive. It could be complex regional pain syndrome, or someone just has a very painful body area. The fluidotherapy can also increase active range of motion. It can decrease edema and increase blood flow to an area. Contraindications are if the person would have acute inflammation, a fever, any active bleeding, cancer, peripheral vascular disease, or impaired sensation. Precautions would include if once you've started the treatment and the client reports that the heat is too hot or the skin gets too red, you might not want to use it again. And you do have to use your clinical judgment when you're working with people who have maybe not be able to understand the directions like a child or a person that's elderly with some dementia. And also you want to be cautious with people that have cardiac problems, and if they have a significant amount of edema, it's probably best not to use it. When you preheat the unit, you can set it to 105, and the temperature needs to be between 105 and 118, or the outer range would be 125, and those are Fahrenheit numbers, so 105 to 125 Fahrenheit. You want to make sure the person removes any jewelry that they might have, and any watches or wristbands. And if they have clothing covering the area, you want to push that up. If they have small open wounds, you can put a Band-Aid over that. And it's mostly done for upper extremity, but you could also insert a foot into it. And generally, a person would use a fluidotherapy for 20 minutes. So there are two ways to put a person's arm in it. You could have the top one, which generally is used for the therapist. So the therapist can work with the client while they're in the fluidotherapy, working on their hand. And the client generally will put their hand or foot in this opening. So you want to go ahead and put your hand in here. And then I'm going to go this way. Going to make sure that the Velcro is secure. And push your sleeve all the way up. There you go. And you want to make this secure but not too tight. All right, and you might want to scoot just a little bit closer. Okay. And for fluidotherapy, you can do the activities. An activity that you might want to try while they're in the sawdust, and today was just telling me she knows American Sign Language, is to work on the alphabet with her fingers. That would be a good activity to do during the fluidotherapy. So I'm going to set the machine. All right. It's set at 115 for the temperature. Airspeed, timer, and we're going to start. It's kind of noisy, so we'll do it for a minute or so, but you generally would want to do this for 20 minutes. You ready? All right. Can you describe what it feels like? Standing your fingers around in it?
Yes.
Okay.
Is this something you feel like you could tolerate for 20 minutes? Yes, definitely. If the air's a little cooler.
Right, so it would feel more comfortable or warmer.
Maybe a little bit warmer.
Okay. Increase the temperature to 125, which would be the highest limit that you would want to go.
Okay.
This one actually stops right there. Okay.
It's easy to move your hand through it.
Okay, and so for the purposes of the video, I'm just going to stop it. If you'll just wait till I get back there and have to take the hand out. All right. And when the client is coming out of the fluidotherapy, you want to make sure that they leave most of the corn husk with the unit. Where's the end of the velcro? There it is. So as you come off, if you'll sort of brush the sawdust, and the client can do this as well once they get used to doing it, and leave all that sawdust in there. Okay, and just make sure you fold it back up for the next person so that. So that none of the corn cob husks fall out of there. All right, and then for using modalities during occupational therapy, you always want to either have an occupation precede or during the use of fluidotherapy or after completion. And one of the things that fluidotherapy does is that it can increase the blood flow, increase the range of motion. So this would be a good time to do gentle, active movement activities like folding laundry, or playing cards, or grading papers, or perhaps fixing a snack. So I'm going to bring a couple of towels for her to fold, and then we'll talk real briefly about documentation. If you would like to come over to this table and with the client, what you're looking for is decreased pain, more active movement while they're doing a task. So if you would mind folding a couple of those. So for documentation, when using fluidotherapy with the client, you would want to note their position in the fluidotherapy, the area that would be heated, the amount of time, which is generally 20 minutes for fluidotherapy, the highest temperature that they tolerated, and then their response to it. So once they complete an occupational task, you would ask them if there's any change from when they complete the task without fluidotherapy and when they complete